Seniors in Health is, we're calling that to order. Secretary, please call the roll.
Senator Bratton. Senator Carter.
Here.
Senator Lewis. Senator Hudson.
Here.
Senator Nicola.
Here.
Senator Nuremberg.
Here.
Quorum is established.
Thank you. With quorum established, we are going to just go ahead and roll right into Senate Bill 598. Is he here? No? All right. Senator Mosley here? Is Representative Parker here? We're going to go with you. The early bird gets the worm. Great. So this is House Committee substitute for House Bills 177 and 469. Representatives, begin when you're ready.
Thank you. Good morning, Chair Carter and committee members. I'm Cameron Parker, representing the 150th District in Southeast Missouri, it's made up of Dunklin, Pemiscot, and Butler County. Thank you guys for having me first this morning. We're here on House Committee Sub for House Bill 177 and 469. I'm here with Representative Joe Dahl. This legislation allows for the coverage for Missouri HealthNet to be extended to medically necessary hearing instruments and cochlear implants. One of the main reasons that we filed this is the ability to hear and communicate is critical to a person's independence. Studies have shown that if you treat hearing loss, it reduces the risk of falls, it improves cognitive decline, and allows for the ability for folks to financially support themselves and get back in the workplace. Specifically in my law practice, I had a client a couple of years ago come in, and she had hearing aids her entire life. At age 22, they had broken. At that time, she was working at the local McDonald's, which was a great job for her, a first job for her, trying to support her child. When they broke, she did not have the money to afford her hearing instruments, thereby losing her job and not being able to stay in the workforce. I believe that hearing loss affects many folks in the state, across the state. In my family alone, both my parents have hearing aids. My mother-in-law has a cochlear implant. And so this is something very important to me. And I think by adding this coverage today, we help Missourians across the state. Yes, there are some costs to this, but I believe the benefits greatly outweigh the cost. With that, I'll turn it over to Representative Dahl.
Good morning. Joe Dahl, representing House District 91, South St. Louis County. And just to add what Representative Parker said, I think it's really important to know the impacts of hearing loss. We know that people who have hearing loss, their unemployment rates are double that of people with hearing, and your risk of dementia increases dramatically with hearing loss. So I think if you catch people early, you can help people get their quality of life back, reduce falls, reduce dementia, which ultimately reduces healthcare costs for the state.
All right, thank you. Representatives, any questions for the representatives? Senator Lewis?
Good morning, representatives. I just wanted to say it's so good to see you continuing to partner on this bill, and just lovely to see you all again.
Any other questions for the representatives? Seeing none, we will begin with testimony in favor. Are there any here to testify in favor of this bill? All right. Come on forward. For those here testifying, we just need to make sure that you fill out a witness form and just leave it there on the table and check your mic to make sure the green light is on. Begin when you're ready.
Good morning. Madam Chair, members of the committee, thank you so much for the opportunity to speak with you this morning in favor of House Bills 177 and 469. My name is Dr. Kathleen Sinks. I am a board-certified audiologist, the Director of Audiology at the Center for Hearing and Speech, a member of the Missouri Academy of Audiology, an ambassador for the American Speech Language Hearing Association, and a state champion for the American Cochlear Implant Alliance. The ability to communicate is a fundamental human right. For those who choose to do so by spoken language, hearing is absolutely essential. Imagine trying to navigate your daily lives without the ability to hear someone walk up behind you, or interviewing for a job or conducting meetings when you can only understand a fraction of the words being said. At the Center for Hearing and Speech, we have welcomed all persons, regardless of their ability to pay, through our doors to receive transformative speech and hearing services for over 100 years. As a nonprofit organization, we fundraise over $1 million annually to provide hearing aids, cochlear implants, assistive communication devices, and speech therapy to your constituents when the lack of health insurance coverage or limited financial means would otherwise be a barrier. When the comprehensive hearing benefits were eliminated for the Medicaid program for most individuals over the age of 21, nearly 20 years ago, it became clear that Missouri residents with hearing loss faced obstacles to receiving appropriate medical treatment. We've had an entire assistance program dedicated to helping those Medicaid recipients to obtain these devices. In 2024, 1,694 people received financial assistance for hearing aids and cochlear implants from our organization. Of those, 461 had active Medicaid coverage and were excluded from comprehensive benefits under their plan codes. That is 467 people who, with their hearing aids and cochlear implants, were able to run errands independently, who secured or maintained their employment, who were able to enjoy their hobbies and reconnect with their families. However, we cannot meet the needs of the entire state. Currently, there are 36 states that offer full coverage for adults under Medicaid for hearing aids and cochlear implants. Missouri needs to be one of them. Our efforts here are not only supported by thousands of professionals who serve the people in need throughout the state, but also by national organizations such as the American Cochlear Implant Alliance, the American Speech Language Hearing Association, and the American Neuro-Otology Society. For all the reasons I have mentioned this morning, I request that you vote in favor of House Bills 177 and 469 to include hearing aids and cochlear implants for all Missouri Medicaid recipients. In addition, these bills have passed through the House with overwhelming support, and bills using this same language were passed through Senate committees last year. And so again, I urge you to vote in favor. Thank you very much.
Thank you for your thorough testimony. Any questions for the witness? Seeing none, we appreciate your time. Thank you. Next in favor? Begin when you're ready.
Okay. Good morning, and thank you for the opportunity to allow me to speak on the needs of those with hearing loss who cannot afford hearing devices. My name is Julia Biedenstein. I am actually a teacher of the deaf. I have been working with people with hearing loss for 46 years now as a teacher, a school administrator, a researcher, and more recently as a consumer specialist with a cochlear implant company. So during this time, I've watched children grow up with their hearing aids and cochlear implants, and I have been truly amazed at what these kids were able to do once they got access to a clear, crisp signal. The progress that they make is incredible. But more recently, I've been working with some adults who are Medicaid patients and are not able to afford hearing devices. And I watch what happens to them. They lose their jobs because they don't understand what's going on in their work environment. I've watched people with hearing aids who really would benefit from a cochlear implant but can't afford it. So they're almost in the same boat. They can't understand the conversation around them. That impacts once again, their job performance. It impacts their social interactions with people, and it also leads to depression and withdrawal. And so for me, it's very, very important that we fund hearing devices for all people so that they can be productive members of our society. So I vote in favor. I would ask you to vote in favor of this bill.
Thank you. Any questions for the witness? Seeing none. Thank you for your testimony. Make sure you leave your witness form there on the table. Next in favor? That's what you get for being
Sorry, Madam Chair, I
on
had
the
to do
front
that.
row.
Brent Hippill here on behalf of the Missouri
Did you say you were
Speech.
sorry?
Pardon?
Or did you say you were sorry?
Sorry about jumping in front of Mr. Winton. Brent Hemphill here on behalf of the Missouri Speech, Hearing, and Language Association, which is comprised of about 1,000 audiologists, but primarily SLPs. We've been working on this for several years now. It had obviously ran into some hiccups last year on the Senate, but we'd like to see this bill get across the finish line this year and want to go on record in support of this bill.
Can you talk to me just a little bit about what the hiccups were? Was it legislation or
Do you, no, there was nothing about the policy of this.
some
I think
personal
the-
conflicts? Potentially?
Yes, yeah.
All right, thanks. Just wanted to make sure. Thanks. Any questions for the witness? Seeing none, thank you.
Thank you.
I didn't see a nod, so I think you're still in limbo.
I just assumed he said yes. Madam Chair, David Winton here on behalf of the Reach Foundation. Want to go on record in support of the legislation. Thank you for the time, consideration, and the sponsors for bringing the bill forward.
Thank you. Make sure you leave your, oh, sorry, David. Any questions for the witness? Seeing none. Appreciate your time. Next in favor?
Madam Chair, members of the committee, Randy Sher of Missouri Hearing Society. We're the hearing instrument specialists, and our members see this every day, and they know the importance of it. The sponsors gave an excellent presentation on the effects of loss of hearing. So, and I'm glad I didn't jump in front of. Anyway, I'd be glad to answer any questions.
Great, thank you. Any questions for this witness? Seeing none, appreciate your time. Make sure you leave a witness form if you haven't already. All right, next in favor? Going on. Next, that concludes those in favor. Anybody here in opposition? Thank you. That concludes testimony in opposition. Anybody here for informational purposes only? Okay, thank you. Representatives, that concludes the hearing for House Committee Substitute for House Bill 177 and 469. We appreciate your time. Thank you. All right, I think Senator Mosley is here. Senator, begin when you're ready. This is, committee members, this is Senate Bill 263. This establishes the Cancer Patients Bill of Rights. Senator, begin when you're ready.
Good morning, Chair and Committee. Thank you for hearing this bill today. I am State Senator Angela Mosley, representing the 13th Senatorial District. SB 263 is a Patient's Bill of Rights. Cancer patients in Missouri deserve a clear information, timely care, and access to the best treatment available. In simple terms, you will have the right to understand your diagnosis and treatment options. Doctors must explain everything in a way you can understand in your language and culture. You have the right to get the care you need quickly. That means no long waits for test results or seeing cancer specialists. You have the right to see doctors who are experts in your specific type of cancer. Some cancers are rare or are complicated, and you should be able to see someone who truly understands it. You have the right to pain relief and other care that helps you feel better during treatment. This includes help for your mental health and comfort, not just medicine for cancer itself. You have the right to go to the top cancer hospitals when needed. That includes places known for treating difficult cancers, like top research hospitals or cancer centers. You have the right to try new and promising treatments. This includes clinical trials, research, and personalized medicine that may not be available anywhere, everywhere. I do have a witness here who is a cancer survivor as well as still is dealing with cancer. And I think this will be a great bill that she would like to testify on. And I'll take any questions.
Thank you. Any questions for the senator? Thank you.
Good morning, Senator.
Yes, sir.
Thank you for being here this morning. As I was reading through this bill, I just had some thoughts on it. I know, cancer is a horrible plight on people. I think we all know people that have suffered with cancer, and some have survived and some have not. But most of the things, is there something in here that cancer patients already do not have the right to do?
Well, if you speak to a cancer patient, actual cancer patient, they do feel that they're not getting the treatments that they would like to receive. They don't get to be able to try trial medicines that are out there. But again, there's someone here that can speak a little better on it. But yeah, they feel like that the doctors aren't telling them everything they need to know when they go to their appointments. And so later on they'll find out, I got a big hole this big in my spine that you could have told me about months ago. So those are things that cancer patients have to deal with.
Right. I've had quite a few people in my family and loved ones close, people in my congregation that have had cancer as well, and as well as all kinds of different diseases. So it also makes me wonder, not only do they already have some of these rights, but what about other sicknesses or diseases? So where do we stop with giving specific rights to specific diseases?
Where do you stop at giving specific
Well, if we're gonna
rights? Can you
give
go a little-
just cancer patients specific rights,
So you mean to other issues?
yeah, to other
Health
sicknesses
issues?
like
Well,
cardiac.
I'm not dealing with the other issues at this moment. I'm dealing with just the cancer patients.
I understand. That's why I'm
because-
bringing this
and
up,
like I
because I see
said,
a problem with now.
Every bill I file is a bill that a person came to me and asked me to file. So I filed it on behalf of a person who is dealing with cancer and has had issues with doctors and as well as insurance companies not wanting to pay for treatments that they need.
Yeah.
So
I think that's across
That's
the
where it
board.
goes.
I've had problems as well.
I'm pretty
with-
sure it is,
with all kinds of sicknesses. So,
which is why we have all these other insurance bills that come through that people need and want, because a lot of times your insurance is really not here to take care of us.
right, yeah. So just a last question. If we were to pass legislation to give, this legislation to give cancer patients this Bill of Rights, since they would have a right to this, who's going to pay for this? How is this
What do you
paid
mean,
for?
who's going to pay for it?
Well, I mean, if they can go to any, I mean, Sloan Kettering comes to mind. Sloan Kettering is in New York City and Manhattan. They're a top cancer hospital in the nation, one of them. So if
Your
they have a right
insurance
to
company
go,
should be able to pay for that.
so that's the bottom line. What we're wanting to get to is they should have rights, and the insurance company should pay for it.
Correct.
So pay for their transportation,
Pay
putting
for
them up in
their
hospital,
treatment.
and their treatment.
I
Okay,
didn't say their transportation, but their treatment.
okay. Thank you very much.
Any other questions for this witness? Seeing none. Thank you for your testimony. We'll begin with those here to testify in favor of the bill.
I'm burned up.
Begin when you're ready. Thank you.
Good morning. Good morning, committee. My name is Dr. Nicole Robinson. I'm really proud to be here and to support this bill, SB263. I'm a little nervous, but it's bringing up an overwhelming feeling, me being a stage 4 patient. I was the person who approached Senator Mosley. I was diagnosed with stage 2 cancer in 2014. I went through chemotherapy, I went through radiation, I had a lumpectomy, And from my initial onset of my diagnosis, there are so many things a cancer patient goes through. It's a whirlwind, and so there are so many things that are thrown at you. First, you're just dealing with the notion, I have cancer. But then you have to deal with what's best for me, what's the treatment, and so many things are just thrown at you. You don't really know to ask the doctor, or they don't give you, they said, okay, this is the regimen that you take. But fast forward, I was re-diagnosed in 2018 with stage 4. And when I say metastatic breast cancer, metastatic is when that cancer metastasized to different parts of the body. For me, my cancer metastasized to 3 different areas: the clavicle in my neck, my left chest wall, but more importantly, it metastasized to my spine. So different areas cancer can metastasize to: the brain, the lungs, the liver, and then the bone. So I'm a bone metastasis patient. Blessed to say that I've been here for several years with cancer treatment. But I've had to have so many obstacles, one being, as the senator mentioned, the access. I was initially denied from my insurance company a treatment regimen that's supposed to support my spine, and the insurance company denied. I had several appeals to the insurance company to get the drug. So they went through this failed first method, is when a drug, they want you to fail at one drug because of cost, so that if that doesn't work, maybe we'll try a new one, not what your oncologist may prescribe to you. And so I dealt with having, when you're dealing with your care, you shouldn't have to battle for access, even when you have insurance. So I was denied that. Luckily, I went and started a petition to advocate for myself. That's one thing as a cancer patient, you learn how to be an advocate for yourself. Because when you're telling a doctor that I'm having some pain in my spine and they dismiss and they go by the textbook of what they think may happen. So I experienced this firsthand. I was told, I kept saying I'm having this pain in my spine. And my doctor, he's like, well, let's look at your lungs. Long story short, I had a hole in my spine. They had to insert cement. If I would have had a freak fall, I could have collapsed my spine. So I had to have cement inserted into my spine, a procedure that was done to stabilize my spine. So even though my cancer had metastasized to different areas in the spine, this was an area that the cancer had eaten. But it's so disheartening when you are telling a doctor, I'm having this pain, or I'm experiencing this, and you're dismissed, or you say, is there something that I need to be taking? Fast forward, I've had some other adverse effects. Even though on the outside you see me, I look like I don't have cancer, but you don't know the physical scars and the mental that I battle with. And I fight every day just to keep that smile on my face. But deep down inside, it's a mental battle that we have to contend with. So this Patient Bill of Rights gives me access. It gives me a voice. It gives other patients voices when we're not heard. It's just the ability, SB263, it can just amplify what's also missing, not just me as a cancer patient, but there are other chronic diseases. But for me, I'm stage 4. And I'm racing against the clock. When I wake up every day, I'm thankful because I made it one more day. But then when I go to treatment, I have to contend with all these other issues. Are there clinical trials? Initially not being told at clinical trials. They're just giving you, and so you're forced to do research on your own, and then you're forced to ask additional questions when you're not told. It's not clear. And so you struggle, and you just try to manage through, but then to try to keep your sanity as being a cancer patient. And so I'm really just here. I want to live. I want the best treatment. I want to have the right to be able to ask my doctors and get clear understanding, and maybe even misdiagnosis. When I'm telling a doctor there's something showing up on my scans, and then you never address it, you don't address it, and now I have fractures in my femur. And so I'm dosing up with pain pills only so I can walk to be here today. And so I just urge the committee to vote yes for this bill. I deserve a chance. I deserve a right. I have grandchildren, 6 beautiful granddaughters. I want them to see me not just have to fight, but I want to see them graduate college, have kids. I want to be here tomorrow. And so this is what this bill will provide for me, the voice.
Thank you for your testimony. I just want to say I know how intimidating it can be to come and testify, and so I just want to commend you for your courage, and I think you're gorgeous. So thank you for showing up with a smile on your face and for sharing your story. I think what we're seeing, and I hope I'm not just speaking for myself, but for our committee here, that we're seeing on a lot of different levels the need to kind of reform. You know, you have doctors on one hand that are saying they have 15 minutes to see a patient.
Yes.
You know, that even though they want to spend
Yes.
more time with the patient, it's
Yes.
very administrative. And so
Yes.
we do really need to start to kind of unpackage some of this and let the doctors be doctors again.
Yes.
And so anyway, thank you for your testimony. Thank you for being
Thank you.
here. Any questions for this witness? Senator Nicola?
I want to thank you too so much for coming today. I know it was
Thank
hard.
you.
You said you were nervous, and I completely understand that. And I'm certainly sorry for everything you've had to endure because cancer is absolutely horrible. And I was telling the senator, I have many loved ones that are
Yeah.
dealing with it now. I have a very close family member that was diagnosed with stage 4 breast cancer about 2 months ago. What you explained about your back, my stepfather died 18 years ago. He had back pain. They
Yeah.
misdiagnosed it, kept sending him to a chiropractor. By the
Yes.
time they figured it out, it was too late.
It's
It
too
was all
late.
over his body. My first campaign manager, a dear family friend, died a year ago. And she struggled probably a dozen years. And she did. And she had to advocate for herself. They all do.
Yeah.
It's the medical community is still practicing.
Yes.
And depending on the doctor you have or where you go, some doctors are really, really good. Some are very smart. Some are more educated in certain fields or certain cancers. And it's a difficult thing, as the chairwoman was saying, to kind of straighten out and get it, figured out.
Yes.
And it's, my dad, I mentioned Sloan Kettering. It's a world famous in Manhattan, but they're not perfect.
Yeah.
And mistakes are made. And when we're humans, how we can overcome the mistakes, it's really impossible, to do. So, again, I'm sorry for what you're going through. As I read this, I'm not sure this is going to fix our problem, this particular bill. And I meant to ask the senator this question, but you're the one that presented this bill to the senator, so I can ask you.
Yes.
On the first page, it says treatment options in a culturally appropriate and understandable languages. I know, obviously we're a multicultural nation here,
Yes.
but we have a national language of English. So I'm wondering, what does it look like from your perspective to have these diagnoses, to be informed, and treatment in a culturally appropriate and understandable language? What does that look like?
So for me, an African American patient, there's so many disparities. More than that, even your socioeconomic status. Some we might not have insurance, but just the be able for the doctor or a health provider to explain, or not just dismiss. If I can just give an example, I had to report the cancer doctor, the oncologist that I was attending, because you don't see them anymore. You see the practitioner, and so you're telling the practitioner, and then they go tell the oncologist, and so there's just this miscommunication. I wanted to transfer to get another doctor. I went to go to another facility because I felt like the cancer treatment, the facility, it was too big. The doctor had too many patients. I'm just a diagnosis. I'm not even a person. I'm just stage 4. I'm not going to live anyway. But they don't tell you. They don't go in depth. And so you're looked over. And I had an administrator tell me that, you've had a lot of doctors. I'm like, I'm looking for the best care. I want to live. I'm stage 4. I don't have tomorrow.
Mm-hmm.
And it was just disheartening because I had to explain why I wanted another physician just to be able to care for me properly, to have the right team.
And so that was the most disheartening part. So the language and the way they deal with you. And I had to say, if this were your mother, if I was your mother, wouldn't you be fighting for me? Wouldn't you want me?
Absolutely.
And that you have to turn that and ask that question, because sometimes it just goes mute. And sometimes not to have, but they're just racial disparities, right? If you don't have the right insurance, and there's economic disparities. So if you have the best, you receive the best. If you don't, we're not here tomorrow.
Mm-hmm. Yeah. Okay. Thank you very much for your testimony. Again, thanks for being here.
Yeah, thank you. All right, any other questions? Blake, any questions?
You and I.
Thank you for your testimony.
Thank you so
Appreciate
very
it.
much. Thank you.
Anyone else here to testify in favor?
Thank you, Madam Chairwoman, members of the committee. My name is Arnie C. A.C. Dienoff, State Public Advocate. I submitted my form online. This is heartbreaking testimony that I just heard on this bill. Patients should never have to worry when they have this, I don't even say the word, starts with a C, ends in an R, and it's too prevalent across Missouri and across our country. And it's a shame that pharmaceutical companies spend more money in marketing and luring doctors to buy their drugs than they spend on research and development. And I think it's backwards. We need to spend the money on research and development and less money on marketing and trying to lure doctors to buy pharmaceuticals from the pharmaceutical industry. Patients in Missouri should never have to worry. We need to have Missourians' backs in times of need and crisis. We need to treat all Missourians as human beings, that they feel that they're cared about whether they have the insurance means or not. Some people have a Cadillac insurance policy and some do not. Rather than just being a number, I think that the insurance industry and that our state cannot ignore the issues and the status of over the almighty dollar. Sometimes it comes to profit over the protection and care in time of need for Missourians who need the medical health care, understanding, compassion, and great health care. This patient bill of rights is needed, in my opinion. This should be a true nonpartisan bill and the right of life for fellow Missourians. Too many times we fight on partisan politics. In this case, it's a Democrat. I don't think that it really should matter. We should put Missourians first in terms of this issue. And so I would like to see this bill worked on. If there's amendments that are needed that was brought up in the testimony, then we need to make this bill and the rights of Missourians when they have this ailment and this disease that is so chronic and turns families upside down. I know somebody in O'Fallon that was on the city council that within less than 30 days, he had a particular attack of this cancer, and he lost his life within 30 days, and he was around 50 years old. So we need to really value life. We never know what tomorrow is going to bring, and so we really need to work on making sure that our citizens are taken care of. And for those reasons, I support this bill. Thank you, Mr. Vice Chairman, I guess.
Yeah, thank you. Thank you for your testimony. Any questions for the witness? Seeing none, thank you.
Thank you.
Appreciate it very much.
Thank you.
Next, in favor of this bill? Going once, twice, three. In opposition to this bill? Anyone here in opposition? Anyone for informational purposes only? Come on up. It's like an airplane in here, isn't it?
Yes. My legs have never worked.
Let's go ahead and begin whenever you're ready.
Thank you. Thanks to the committee for allowing me to provide a little information. My name is David Barnes. I'm here representing myself. I'm actually in this hearing to represent another organization on a different bill, but sitting here, having worked at Ellis Fischel Monday morning to take care of cancer patients by accessing their ports and drawing blood and setting them up so they can get their cancer treatments, I feel for the senator's bill on this. I have not read it. I do not. So my information is this: I continually have to educate those people. I had one couple, a son and a mother, coming in who didn't understand what the port was for. It had been placed earlier. I was accessing it for the first time, and I had to spend 5 or 10 minutes while I had 6 other patients waiting because I was the only one there, and I'm a clinical float nurse. So they normally would have 3 people there doing what I was doing by myself. And I took that time because it was important for them to understand that what I was doing was a sterile process. I was accessing this port to draw the blood so that they could see whether or not it was appropriate for her to get treatment, and that the procedure, they had no clue on that. And I hopefully they left there as a nurse, as part of my job as a nurse advocate or a patient advocate, to them to understand what they're going through to really relieve their fears of what's going on. Now, did I help with their cancer treatment? Only in the fact that I expedited them to be able to get that taken care of. I know nothing about how they came out because HIPAA doesn't allow me to access that down the road, and that's fine. I just wanted to bring that along, that education of what the options are and how these people go through with hardly anybody helping them understand the steps. And thank you for your time.
Thank you for your testimony. I appreciate it, and thanks for the work that you do. Any questions for the witness? Thank you very much. Anybody else here for informational purposes only on Senate Bill 263? All right, seeing none. Senator, any closing remarks?
Thank you for allowing me to bring this bill today. This may not be the end-all, be-all, but it's a beginning, and that's where you always have to start at the beginning. It's not going to be the end of everything. It's not going to be perfect in the beginning. That's how you figure out what's wrong and how to fix it. We've passed other bills of rights in this building for specific people, so I don't think it should matter whether or not this is for a specific disease. Just like it didn't matter that it was for a specific profession. So I urge you all to vote this bill out and vote it out unanimously. And thank you for your time.
Thank you, Senator. Appreciate it very much. That concludes the testimony on Senate Bill 263. Next will be Senate Bill 598. Senator Gregory. Welcome and good morning to you, sir.
Mr. Chairman, members of the committee, David Gregory, St. Louis County, 15. Before you is Senate Bill 598. This is the Vital Records Bill. So right now, as the law currently sits, anyone can call the Department of Health and Senior Services today and ask for a name and date of birth of everyone who's been born today or died on today. And so that's the caveat. You can ask it for each day. And so we have companies, we have people, some fraudsters calling every day saying, give me the list of everyone who died today. Give me the list of everyone who was born today. And as you can imagine, with a name and date of birth and a death date, there's a lot of fraud that can occur with that. We're the only one in the country that has such a loose allowance of request of vital information. So what this bill seeks to do is to tighten that up and not allow people to get that type of sensitive information by calling each and every day. I've got Ben Terrell with the Department of Health and Senior Services. He's our liaison. We all work with him. He's here to testify in favor as well. And with that, I'll take any questions.
Thank you, Senator. Appreciate that very much. I had a couple questions for you, but you answered them in your testimony, so I appreciate that. But I do have another question. So our law right now, if I want records for somebody that's born or died, I can only get it for today. I can't get it for yesterday, can't get it for...
You can get it for any date requested. So you can't say, give
a
me
range.
the last 6 years. You have to do it per day. Like you have to,
Okay.
you have to request. I think you have to request a specific date. So you could say yesterday. You could say any day, but it's for one day. So all they do is call every day and ask.
Oh, so I can't get today's and yesterday's?
Yeah,
in
I
a
think you
single
have
call?
to make 2 separate requests.
Okay.
Exactly. I think.
Okay.
Ben will answer that question for us.
Yeah, thank you.
Yeah.
Any questions for the senator? All right. Anybody here in favor of this bill? Thank you, sir.
Hello. My name is Ben Terrell. I am the Legislative Liaison for the Department of Health and Senior Services. I want to thank Senator Gregory for his time and for his staff's time in this bill, and thank the committee for their time. As Senator Gregory said, we administer the Bureau of Vital Records, and these records they are protected, confidential, and can only be released to individuals in order to protect the privacy of citizens and private security concerns related to identity theft and fraud, with one caveat, and that is this caveat where if somebody requests a specific date in time, they can get a list of all deaths and births that occurred on that date, which means we would be releasing an individual's name, their birth date, and if they'd passed their death date. We have seen entities that have come to the department and requested every single date in BVO and Vital Records history to capture every single person's name, date of birth, and date of death. And then those get posted online, which then obviously raises concerns about data privacy and stuff like that. And things you can do with a name and a birth date or death date if relevant. There are concerns about accessing personal records, social engineering. I know if somebody called me with my wife's name and birth date, I would think it was potentially someone from the pharmacy, because that's all you need to get a prescription or something like that. So those are our concerns. This is not going to save the world as far as data security concerns go, but we take our role in managing data very seriously. And so we want to make sure that we're doing everything we need to be doing to protect it. And so that's what this is trying to address.
Very good. Thank you very much. Any questions for the witness? Well, thank you, sir. I appreciate it.
Thank you.
Next, in favor of Senate Bill 598. Going once, twice, 3 times. Any opposed?
Good morning once again, committee members, Mr. Vice Chairman. My name is Arnie C., AC Dinoff, State Public Advocate. I submitted my form online electronically. I have to oppose SB 598 on the repeal disclosure of vital records. This goes to the core heart of what public records are and the openness of our public records. There are a lot of people across our state that do genealogy, that there's a lot of historic value in the Department of Public Health vital records. I feel that there needs to be disclosure to residents who have a legitimate purpose of doing this type of research to find their family heritage, to find where their family lived across Missouri. This bill opens the door to further closures of state government and further limits the ability of our citizens to have access of documents that should be opened to them. There are several bills through the legislature that want to restrict data, whether it's the Department of Natural Resources, whether it's the use of water on farms. And I think once we start tightening these screws and having these type of laws, it will lead to further closure of public records. This is a violation, in my opinion, of our state sunshine law and the Public Disclosure Act under Chapter 610. This further erodes the Chapter 610 and the right to have access to public documents. We need to balance the needs of legitimate citizens to do research and to have the ability to gather this information in some type of comfortable, fitting environment versus businesses who are out to take advantage of Missourians or have consumer scams. That's why we have the Missouri Attorney General. That's why we have the Securities Division of the Secretary of State to look after citizens. We have a very active Consumer Protection Division of the Attorney General's Office. If there are scams happening with people's information, I'll tell you right now, you could put anybody's name on the internet and you could find out just about everything about that person, including their birth date, their address, where they've lived in past homes. It doesn't take a lot of effort with today's age and today's information to find out about somebody's background. So for those reasons, because it erodes our Chapter 610 or our Open Public Records Act, I have to oppose SB 598. Thank you, Mr. Vice Chairman.
Thank you for your testimony. Any questions for the witness? Seeing none, thank you. Appreciate it very much. Anyone else here in opposition? Seeing none. Anybody here for informational purposes only? Seeing none. Senator, you are welcome to close.
Close.
Thank you, sir, very much. Appreciate it. Well, that concludes the hearing on Senate Bill 598. We will now hear House Bill 943. Good morning.
Good morning.
So good morning. I'd like to thank the Vice Chair and the committee members for allowing me to present House Bill 943. For the record, Representative Tara Peters from Rolla St. James, District 122, home of great Missouri wine, and we make great engineers since we are the home to MS&T. So I would like to present 943 this morning. I know that this committee loves health care, and I know that this committee wants to make Missourians healthier. So this is a package that I'd like to present with a big red bow. I know it's a very large bill that has a lot of components to it, but basically you guys have heard this version through Senator Rusty Black's 317, so I'll try not to go through all of the information. But half of this bill basically involves emergency medical services, and the other half health care. There are a couple components that are different from Senator Black's bill, but basically our EMS services, we're going to have district board of directors, we're offering community paramedics, we're offering a state advisory council on emergency medical services, and in the second half with health care, we are offering to make healthier moms when it comes to testing for STDs. We're going to expand the scope of limits on over-the-counter drugs. We are going to the administering of some medications. This also does include Representative Parker and Representative Dahl's hearing aids bill. Prenatal testing, it offers some opportunities for some dental care providing in prisons. It has some long-term referral guidelines. And then a couple of the things that Senator Black's does not cover. This is going to allow occupational therapists to be added to the list of providers that will issue our disabled license plates and our disabled windshield placards. It also has some other changes for some EMS opportunities for some others across the state of Missouri. And it will also omit the sunshine on our RX Cares for Missouri program. So I know that the bill is large, but just know that last year there was a lot of health care legislation that all went through and it just got tied up in processes. And so we are offering this package to, again, make Missourians healthier. So I appreciate the opportunity to present.
Well, thank you very much. Appreciate it. I do have to ask you a question about something.
Yes.
So I had to look it up because I've never heard this word before, and I can't pronounce it at all. It's a vaccine for, I'm just going to say chick.
Chickaganda.
Chickaganda.
I practiced it a lot of times, yes.
All right.
It is just adding that to the list of ones that you can get from your pharmacist.
Is this a problem, this Chickaganda thing?
Not that I'm aware of, but apparently the industry that offers the vaccinations wanted to make it available just in case.
Okay. Thank you very much for
You're
your
welcome.
testimony. Any questions for the witness or the representative? You want to come up with one? I'm just kidding. Yes, Senator Lewis.
Good morning, Representative.
Good morning.
I just want to say thank you for all your hard work on this comprehensive healthcare package. Dove into it, and it's all non-controversial. It's all been vetted, so I appreciate you working with a variety of stakeholders to bring this before the committee.
And I thank you as well. This is a very proudly bipartisan bill. I know you've provided a lot of hard work in this as well. So, yes, definitely thank you to all those who made this a great package.
Any other questions for the representative? Seeing none, thank you. And you are right, this is a very large bill, and I'm looking forward to hearing the testimony on both sides.
I appreciate it.
Yeah,
Thank
thank
you.
you. Anybody here, and I'm certainly there are, in favor?
No, I'm going to sit right here.
You just clear the table, don't you, when you show up?
Oh, goodness.
Are we going to need a sergeant in arms in here for
Yeah,
that guy back there?
I would recommend it, Mr. Chairman. Mr. Chairman, members of the committee, Organ Schlemer on behalf of, I've got a few folks here, Missouri Pharmacy Association, Centurion, and the Missouri Assisted Living Association. Very quickly, Missouri Pharmacy Association, you brought up one item. It is kind of weirdly worded in there. I think that vaccine that you referenced, Mr. Chairman, or now Mr. Vice Chairman, is an exclusionary piece, and the RSV is the only piece. And they're just by moving the date, it just says these are already allowed. You can just get it at your pharmacist if you want to, instead of having to wait to get into your doctor, which people have a hard time getting a timely appointment sometime. All right. Secondly, Centurion, there's a provision in there that is a carve out on how a dentist can interact in a prison. It's very narrowly tailored. That one also made it through last year very well. Missouri Assisted Living Association, on behalf of two items in there. One item is on what they call subcutaneous. So right now there are people specifically trained that can administer insulin in a facility, and because we now have insulin substitutes, if you will, but they're injected in the same manner, they can also, if the patient needs an insulin substitute instead of insulin, the law now is updated with technology and doesn't just say insulin in there, it's insulin and these other types of medications. Finally, on that piece, our representing Missouri Assisted Living Association is a provision in there regarding referral agencies. I think I've met with many of you on that item, and that is where the elderly is searching for an assisted living facility, and the bill simply states that if you are going to portray yourself as helping the elderly find a facility that best meets their needs, there should be some basic disclosures to that elderly. Typically, a person who's looking to go into an assisted living facility and move out of their home is normally not in the perfect state of mind, and I think extra caution with some basic disclosures and some acknowledgement that the elderly actually receive those disclosures, as well as allowing them out of these agreements that they unknowingly enter into instead of having to wait 3 years. So with that, Madam Chair, I'm done.
Any questions for this witness?
Yeah.
Those would probably be better kept offline. Thank you. I heard it was going off the rails down here, so I had to come and slap the hands of the co-chair here.
Good morning again, Madam Chair. Brent Hemphill here on behalf of the Missouri Ambulance Association and the Missouri Speech and Hearing Association. So just want to echo the hearing aid component is within this bill. Want to go on support of that. It's identical to the bill that you just previously heard. The other, if you look at the language or the number of pages, it deals with a lot of ambulance service. A lot of this has already been vetted through both chambers of the House. It deals with the State Advisory Council on EMS and who appoints those committee members. It's changed from the governor to the director of health. And the reason we asked to do that, because of the backlog, we have folks that are deceased. It's purely an advisory committee. It has no statutory authority to set any kind of rules or policies.
Is it like just a best practice?
It is. It's purely advisory that they come up, and it really is very important because when you deal with EMS, it's comprised of physicians, of fire, of healthcare in the emergency room, obviously EMS, and they go in a room and they vet it out and they hash out issues and then they come up with recommendations. And going through the advice and consent process can be somewhat cumbersome and very long. And so, like we said, we have a number of vacancies and we're just looking for streamlining because we have a lot of people who are wanting to serve on this and just run into headwinds because of the gubernatorial advice and consent. The other is we have what's called community paramedics. These are not when the lights are flashing. These are folks who are paramedics, EMTs, who go into a community and try to address the high-frequency utilizers who call 911 and end up in the ER. We want to set up a program which is already underway. A lot of insurance is already reimbursed for this. We want to streamline it better. So if you have a group of folks who are high utilizer, which we call frequent flyers, that we can do some preventative care, like check in on them, make sure they're doing okay, so they don't end up calling 911. And then the other is the MU Health ground ambulance service. For some reason, when we passed the FRA on ground ambulance back in 2008 or 9, for some reason we excluded the university. It is, this bill would include them in the ground ambulance. I think they're the only one that's not included. So we want to go on record in support of that. And then lastly, we had an instance in Reynolds County that literally woke up one day and says we aren't going to provide ambulance service. The board quit or wanted to quit, the administrator. So we took it upon ourselves, my organization, to go, we can't do that anymore. We have to provide that basic level of care. So the legislation, which I will call struggling ambulance services, requires more training, requires that the Department of Health can go in and pull licenses from ambulance districts who aren't doing their job. And so I think it's a good way or a good step in increasing the ambulance services that I represent and raising that floor to provide. You have to have so many ambulances running and throughout the state. You have to have them trained appropriately, and you can pull their license if they don't do it. So I'd be happy to try to answer any other questions.
Any questions for the witness? Seeing none.
Thank you.
For your testimony. Next in favor.
Madam Chair, members of the committee, Jacob Scott with the Missouri Association of Osteopathic Physicians and Surgeons and the Missouri State Medical Association. I wanted to go on record in support, mainly just wanted to come up here and prove that I can be in favor of a bill. And I've read it, all 51 pages, and it looks pretty good to me. So happy to answer any questions.
All right. Any questions for this witness? Thank you. Next in favor.
Thank you, Madam Chairwoman, members of the committee. My name is Arnie C. A.C. Dinoff, State Public Advocate. I submitted my form electronically online. I think that this bill was merged of other bills. I testified at the committee for part of this bill, and then I see that I also testified against this bill. But overall, I'm for it if we can make some really good amendments here. When it comes to ambulance districts, there really needs to be a cleanup. Because in first class and charter counties, there is the employees run ambulance directors and spend about $35,000 to get directors elected to these boards. And so they want rubber stampers and puppets on a string. There are very basic and minimum requirements on ambulance boards. And so part of this bill allows for some type of training. I believe it's a measly 3 hours. These regulations or requirements, in my opinion, are a joke and need to be realistic to hold ambulance districts and ambulance boards across our state accountable and responsible. One issue that I've been working on for several years in the legislature, and I've been working on, especially this year, on numerous bills that I've testified on other related bills. In first class and charter counties, ambulance boards and fire boards alike are allowed to meet up to 4 times per month, and they get paid $100 a meeting. Well, in a lot of these counties, both on the eastern side and the western side of the state, these ambulance and fire boards under Chapter 190 and Chapter 321 of the revised state statutes get a $100 attendance fee. Well, they have a open agenda right now for about 30 minutes, and then they get paid $100. The president of the board gets $100. The treasurer, who's a member of the board, and the secretary, who's a member of the board, gets $50 a meeting. So they close the open meeting under Chapter 610, and then they hold a closed meeting to meet 10 or 15 minutes with their attorney. They get paid another $100 when they never left the building, never had any more expenses, and in my opinion, that's ripping off the taxpayers. So I'd like to see a amendment here for Chapter 190 and Chapter 321 of the state statutes that limits the attendance fee to $100 within a 72-hour period or a 7-day period, whichever you would like, unless there's an emergency or a crisis within the district. It's unconscionable, and citizens don't know that they're being taken advantage of. And if you times this, it's a substantial amount of attendance fees that taxpayers are paying for. The other issue that I'd like to talk about is filing fees. For ambulance director, it's 0 filing fee, like it is for water director across our public water districts. But in the Chapter 321 for fire protection districts, it's the same fee for filing for county office, which the legislature, with the increase of the filing fees for statewide office, erroneously increased for the state statute 115 says the same filing fee that applies to county offices, which is now $100, applies to fire protection district board of directors. The ambulance advisory board makeup, there's some fields that are being cut out, and I testified on that board. I think it needs to be equally balanced of all the facets. You know, there's like a nurse, there's a doctor, there's an emergency room doctor, there's a EMS chief, there's a paramedic, there's a fire chief. There's very facets, and this board is now cutting out certain sectors of this ambulance advisory board makeup, and I want to make sure that all the fields are being equally represented. With the rest of the bill, I don't have any opposition to it. It's a pretty good bill, like what was stated by the senator. And so I would appreciate, as a citizen, that if you would really look after citizens and protect citizens, if you would make sure that we have an amendment on this bill that limits the attendance fee to 1 for 1 meeting. You can't have an open and closed meeting and make them into 2 meetings. That's just taking advantage of the system, and it's a loophole that we need to rectify. Thank you, Mr. Vice Chairman.
Thank you for your testimony. Appreciate it. Any questions, Senator? Thank you.
Thank you.
I appreciate it very much. Anybody else here in favor of House Bill 943?
My name is Jeff Ballou. I'm with Transitions for Senior Living. Thank you, Senators. Thank you, Representative Peters, for bringing this forward. Just for a little bit of framework, the referral and placement portion of HB 943, let me try to give you a framework of how that works. The business model in referral and placement is much like a real estate agent business model. A retirement community may enter into an agreement with the referral and placement company like mine or like many others that are here, and they pay them for bringing forward qualified clients. If the senior moves in, then we're paid a finder's fee or a referral fee is often paid to that service. The contract is between the community and the referral and placement service. That's an important piece. Much like a house seller, it's like paying a real estate agent for finding and bringing them qualified buyers. However, there are internet lead aggregators that go to an extreme and often rather nefarious lengths to get potential client data. They allow unrelated people or distant relatives without legal say to provide contact information, which the lead aggregator then shares with their retirement community partners with whom they have contracts. Meaning I could provide your mother's contact information and you can't stop it. If the senior wants to use a different service or no service at all, there is currently no remedy to release them from the grips of these aggregators. A large number of the lead aggregators' clients don't know they're being represented by lead aggregators. In my experience, about 80% of the families that are falling into that rabbit hole don't know that they are there, didn't ask for, and don't want their help. But the lead aggregator keeps sharing their information with retirement communities. I've been with them, with my clients, when they've requested and demanded that those aggregators stop. Take Pauline Labarge, age 87. I was in her room when she asked them to please stop calling her, please stop sharing her information. She doesn't know how she got on the list and doesn't want their help. Instead, she wants someone else's help. Again, did you know that your Aunt Mary in Maine can put your parents' information in the system? And currently in Missouri, you can't stop them from distributing that contact information or from the harassing phone calls, even though neither you nor your parents authorized such actions. My own father, George, was a victim of this 15 years ago. It's only gotten worse. It was so frustrating and maddening for me, I started my own business operating differently, operating honestly, transparently and without bias, just like 20 other referral and placement companies across Missouri operate with transparency. Please don't fall for false platitudes you might hear that this legislation might make it hard on families or on placement services. That couldn't be further from the truth. Or that families would have to start paying for my service. And again, my service, I'm paid by senior living communities that choose to utilize my service. None of those platitudes are true. The truth is simply this. The HB 390 portion of HB 943 simply does require us all to be honest, to disclose that we're paid for by living communities for helping the seniors move. It requires we disclose that we have ownership interest in a retirement community. It allows families to choose who they use or to use no one or to disengage, to be able to change their mind. It requires that we get approval of a client to represent them or to be paid for representing them. No placement service should have clients held captive for years, as we currently have, because the terms and conditions were hidden on a buried web page that they accidentally clicked to be able to access information. Just that simple. Honesty, disclosure, choice, and agreed upon representation. 20 different entities in Missouri support this. The only people that you'll find that don't support this are billion-dollar venture capitalist companies who feel like honesty and transparency doesn't meet family needs. I feel like it does.
Thank you very much for your testimony. Any questions for the witness? Go ahead, Senator Lewis.
Good morning.
Good morning.
Did you testify on this part in the House?
I did.
You did. Okay. I wasn't there, but I had heard that a representative that serves on the committee, went on her phone during the hearing, and for the companies that say they don't do this, and my understanding during the hearing when she filled out the information, got like 3 phone calls or something?
That was Representative Dahl, that's
Yeah.
correct. Another party testified that they don't habitually call families, and so I challenged the representative to simply click the submit button during my 3-minute testimony, and her phone rang 3 times. I also have 28 other written testimonies I'd like to submit from executive directors, from social workers, from physicians' offices that all support this bill.
Right. Well, thanks for filling us in on that. I had heard that, and I know it was just the 2 of us, but I think that's really important to share that real time that was happening to one of our colleagues.
My father got 40 phone calls in a day when we're trying to find him senior living.
Mm-hmm.
I'm not sure who finds that helpful.
Right. Yep. Thank you.
Other questions?
Thank you. Nope, that's it.
Thank you
very
for
much.
consideration. I really hope that 943 in its entirety goes through.
Appreciate your testimony. Thank you. Next in favor.
Since I'm the guy standing, I think I'll take.
I think that was an illegal maneuver.
You're probably right on that. That's always jumping ahead of the line. Yes, David Barnes again. This is the real reason why I'm here for the hearing on that. I'm here representing the Missouri Emergency Nurses Association, and I just want to voice our for this particular bill, particularly that around the advisory council, and an opportunity to have a voice in what's going on in the EMS and the ER by the people who spend the most time at the bedside. Thank you.
Thank you for your testimony. Any questions? Thank you. Appreciate it very much. Next in favor to the very patient one.
Mr. Chair, members of the committee, Nikki Strong, here to testify in favor of 2 portions of the bill. First, on behalf of Haleon, the increase to the limits on pseudoephedrine. You guys have heard this several times in this committee. It would increase the annual limit from 43.2 to 61.2 grams, which would give families approximately 8.5 months of relief through the allergy seasons. And then the other portion on behalf of Missouri Healthcare Association on the long-term care referral language. For all the reasons that were stated before, we support that portion of the bill and be happy to answer any questions.
Thank you very much. Any questions for the witness? Seeing none, thank you. Next in favor?
Mr. Chair, members of the committee, Sarah Schlemer here on behalf of the American College of Obstetricians and Gynecologists, as well as the Missouri Center for Public Health Excellence, to testify on 2 portions of the bill. One is the expedited partner therapy. You've heard this portion of the bill in Senator Lewis's bill, as well as what was rolled into Rusty Black's bill. And then the other is the prenatal testing language. And I know we have worked on that to a great extent in Senator Lewis's bill. The intent is to mirror that language in this legislation. And so I just want to go on record on behalf of those two pieces.
Thank you very much for your testimony. Any questions for the witness? Thank you. Appreciate it.
Mr. Chairman, David Wenton here on behalf of BJC Healthcare Children's Hospital as well as St. Louis County Health Department. Want to go on record in support of the legislation and echo the comments of Mrs. Schlemeyer on her support.
All right, thank you very much.
Thank you.
Appreciate your testimony. Senator, you? Yeah. I guess you didn't have a question.
Go correct it.
Next in favor, please.
Good morning, Mr. Chairman and member of the committee. Olivia Wilson on behalf of University of Missouri Healthcare. I'm just testifying in support of a very small, non-controversial provision in 943. Representative Tara Peters was so generous to add this into her floor amendment. This is, like Brent Hemphill talked about, this would allow MU Healthcare ambulance services to participate in the FRA. When the ambulance FRA was passed in 2009, for some reason that nobody seems to know, if any of you know it, let me know, MU Healthcare was explicitly carved out of that. We are the only entity that's carved out of the ambulance FRA currently. So this very small provision would just allow us to participate. It passed out of the House Ways and Means Committee unanimously. There was no controversy about it on the House floor when it was discussed. It would be, we estimate, about a $60,000 annual impact for MU Healthcare. That can go towards a new ambulance, another EMT. We cover all of Boone County, and in addition with Boone Hospital, we have about 65% of Boone County that we respond to those 911 calls. With that, I'm happy to take any questions.
Thank you for your testimony. Any questions, Senator? Thank you very much. Thank you. Appreciate it. Anyone else here in favor? Okay.
It's a good start.
You notice how the ladies interchange here and come up. There's a huge difference. Just wanted to point that out.
Good morning. Thank you for having me this morning. My name is Erin Dwyer, and I'm here on behalf of my company, Senior Care Authority. So I'm a certified senior advisor. So I represent the portion of the long-term care and senior living bill for referral agents and transparency online. So my company's client was needing a Medicaid skilled bed, and the daughter, unbeknownst to her dad, was online, and an online lead aggregator provided the daughter with some places that weren't quite appropriate for the care and budget that was needed, including only giving private pay options, and she was actually provided the actual name of the community the client was already living in. These online lead aggregators don't listen to client needs. They blast their client info, and the families need to be able to opt out. I actually had this happen to me where I was online doing research, which we fully recommend people doing. You just shouldn't have your data captured for just looking for information. But I was trying to get a hold of an assisted living community for a client of mine, and I called the number and I explained who I was. And the receptionist, I believe it was a receptionist, passed me on to somebody. It was a woman. She was very nice. And I explained right from the get-go who I was, that I was from Senior Care Authority, that I am a placement advisor, and that I was trying to help my client find assisted living. And she went through the pricing and everything, and at the very end, she said, "Oh, and thank you for calling a place for mom." And I said, "Whoa, whoa, whoa." I said, "I didn't know this was a place for mom. I thought I was calling this community, and why did you not identify this till the end of the call? Now you have my client's information," and I explained that I was representing the client. So I thought that was not very transparent. So basically, it's a bipartisan bill. We are just asking for transparency online and the right to choose your own representation regarding choosing senior living. Thank you.
Thank you very much for your testimony. I just had a comment.
Yes.
When you were talking about lead aggregators, I think you said lead aggravator.
Aggravator.
And
I
thought
corrected myself,
I actually
yes.
thought you were talking about me, so
No
thank you.
disrespect. No, it was not
No,
pointed.
is there any questions for the witness? I know.
And I had 3 testimonials that I would also, include with,
Okay.
with Jeff's, from representatives, from somebody that ran a building, an assisted living and memory care, and then a couple different client testimonials.
Thank you.
Thank you for your
No
time.
questions? Okay, thank you
No,
very much.
thank you.
Are you leaving?
We're just trying to give you a crowd. But I just need to go.
Okay.
Where are you? Just go ahead.
Next, next in favor?
Well, I was going to say
All right.
thank you, Madam Chairwoman, but thank you, Mr. Chairman. Tricia Workman here today on behalf of the Missouri Coalition Against Domestic and Sexual Violence, specifically to a provision in the bill that you all have heard in a number of packages that basically says that specialty hospitals, which are hospitals that do not have a 24-hour adult ER, are exempt from the requirements of doing exams for sexual assault victims. They have to have transfer policies to get these individuals to the appropriate place, but they're not equipped to do so, and it would be a disservice to the victims for them to try. So there's been no opposition to this, and we just want to make this clarification and appreciate the committee's support.
Thank you very much. Any questions, Senator? Okay, thank you. Next in favor? Any more in favor? Okay. How about in opposition? Good morning.
Morning, Lisa Panette with Armorvine. Our heartburn is around the prenatal testing on page 33, 210.030. The woman, if she consents, they will take a blood draw. But then that continues on page 34, and if a mother tests positive for syphilis, hepatitis B, hepatitis C, or HIV, or any of the combination of such diseases, the physician or person providing care shall administer treatment in accordance with the most recent accepted medical practice. We want to make sure that this is informed consent. Also, that was changed in the Senate bill, and we had attorneys look at that change, and they said it was not adequate. That change was not enough to add a protection. It simply stated that who can give consent. It didn't require the consent. It just said who can give consent. And on those lines, consent for minors can be given regarding pregnancies and venereal diseases without parental consent. So we want to make sure, especially because we're removing liability, that that we're protecting those that would be receiving treatment, because we won't have any remedy if something goes wrong and they did not consent. That's all.
Thank you very much. Any questions? No questions. Thank you. I appreciate it. Next in opposition. Good morning.
Hi, Mr. Vice Chair, members of the committee. Thank you for the opportunity to testify today. My name is Michelle McGovern, and I'm here on behalf of A Place for Mom, the nation's leading senior living advisory service, to express our strong opposition to the senior referral language in House Bill 943. To be clear, we fully support transparency and disclosure for families who are using our referral services. However, we firmly oppose legislation that inserts a third party, namely families who are merely inquiring about our services, into a private, voluntary business agreement into which they are not a party. HB 943 does exactly that, creating governmental interference in freely negotiated contracts and risking real harm to families, senior living providers, and businesses that help connect them. A Place for Mom is a trusted partner for millions of families navigating one of life's most complex and emotional decisions, finding the right senior living option for their loved one. In 2024 alone, over 50,000 families in Missouri reached out to us for guidance and care. Our role is to provide free, personalized referrals based on a family's care needs, preferences, and budget. I did want to speak briefly to the point about harassment. I'm the general counsel of the company. I listen to family calls often to make sure that I'm, aware of what we're doing and listening to how our senior living associates, who are local by design. So if you're looking for a place in Missouri, you call Missouri. These are 20 to 45-minute calls with families who are at the brink of crisis. This is not harassment. It's people who are listening, caring, guiding, helping people really find and understand the best place for their loved one. These are calls that people request and require in order to find a place for the loved ones that they care about to spend senior years where they are happy and fulfilled. We do not collect HIPAA-protected medical data, and we also do not conduct clinical assessments. Our advisors recommend options from a network of over 13,000 vetted senior living providers, and we're proud to be transparent and accountable. My team checks every single license for every single place that we refer a senior to 2 times a year to make sure that they're in good standing with the state. They roll up to me, I check them every day. If it acted, though, House Bill 943 would have harmful and far-reaching consequences. It restricts the ability of senior living communities and referral agencies to freely negotiate compensation arrangements, that they are freely negotiated and entered into voluntarily by both parties and terminable by either party at any time. There is no obligation for any community to contract with us. Many do because it aligns with their mission to help connect families in need and also to make sure that they're able to find on their potential roster families who are pre-vetted by experts in the field. It imposes an unnecessary regulatory burden for a functioning marketplace. Communities who don't wish to pay us a fee don't ever have to work with us, and if they don't want to continue paying us their fees, they are free to terminate their contract at any time. They do not need a third party who has no privity of contract interrupting and disrupting a productive business relationship. Families who use a Place for Mom are not parties to contracts between a Place for Mom and the family. They're not parties to the contracts between a Place for Mom and the communities that we work with. They are not charged, and they're under no obligation to work with just a Place for Mom. We're non-exclusive, and they can work with as many referral agencies as they want or none at all. Forcing families into fee disclosures and business negotiations, especially during times of emotional stress, will add confusion and not clarity to families, telling them, hey, call a Place for Mom, say you don't want a Place for Mom to pay this community. That adds a level of complexity and confusion to a family that's already at a point of crisis. This bill specifically targets one successful and widely used model of a referral service, both within and outside of the senior living space. You talked about real estate brokers or Expedia. This precedent, I think, would be very difficult for any business that relies on a contract between 2 consenting parties and that has third, non-related parties being able to interrupt that relationship. Importantly, it threatens to reduce access to referral services for thousands of Missouri families every year. To be clear, we strongly support transparency, and we have compromise language that would further increase the consumer protections that we already provide and the disclosures that you get when you call a Place for Mom by codifying them into law. We're not at all opposed to transparency. When you use a Place for Mom, you receive referrals only after voluntarily engaging with us. So when you mentioned putting in the phone number and getting a call right away, that's the service working. If you're a family trying to find a senior living option for your loved one, you put your phone number in asking to be contacted. I'm glad to hear that when you put your number in saying, I would like to know more, that we called you. That's what you asked us to do. And if you don't want to have a call from a Place for Mom, please don't go to our website and put your phone number in, right? It's as simple as that. If you no longer wish to continue receiving calls, you're able to opt out of, again, do not call functions roll up to me as well. We have a strict do not call process. You call and say, I don't want to hear from you anymore. You do not hear from us anymore. That is something that I oversee myself. We clearly disclose that our services are free and that we're paid for by senior living communities on our website, on our television advertisements, and when you call a Place for Mom. Our advisors are not compensated based on the costs of care. We also make sure that and I think it's very important to know, you are not paid any more for referring a senior to a more expensive or a less expensive place. You get the same compensation regardless of where they go. We want them to find the right place to be. The House Bill 943 is a solution in search of a problem. It would disrupt beneficial partnerships, reduce family access to care, and inject the government into private arrangements that are already working transparently and fairly. We urge this committee to oppose the bill and to work together to support real transparency for families without restricting options or penalizing professionals who are working with them. I really appreciate your time, and I welcome any questions.
Thank you very much for your testimony. Senator, if you have any questions, thank you. Appreciate
Thank
it.
you.
You bet. Next in opposition.
Mr. Chairman, members of the committee, Jewel Paddock, registered lobbyist on behalf of Caring, also a senior living, assisted living referral agency as defined by this bill. I really can't say anything more than what has already been said other than my own experience with the platforms. I too, wanted to know what they did, so I put my mom's information into the, she's not ready for a facility yet, not quite, although she did lose her license in the last couple weeks. But put her information in, hit the button, please give me more information. Sure enough, got a call, didn't answer it. Sure enough, got another call, answered it, told him I was no longer looking for it, and I never heard from him again. So I don't know what I would have expected other than to get a call when I hit the button that says, please give me a call for more information. The free information that I received, because my family happened to be in this business for approximately 30 years, was very accurate. I put all the information about Jefferson City. I happen to know most of the facilities in the area. And the good facilities were rated well. The bad facilities were rated poorly. And that was information that was free to me as someone who was just surfing the web and looking for more information. In fact, the only place I could find that kind of information were on Caring's platform and on A Place for Moms platform. The state doesn't provide that kind of information. These independent referral agencies don't typically provide that kind of information for free. It's the only place to go for thousands and thousands of folks across the country and in Missouri to get information that's verifiable, that's trustworthy, and I think the most important part of that function is we call it the Yelp. I don't know if we call it the Yelp function. I call it the Yelp function. It's the reviews on facilities, people that actually went there, and we do a very good job at trying to verify that information. If you want to know what people have experienced in facilities locally, and you're not from the area, which is typically how you're trying to place someone. If you live in the community, it's fairly easy to place someone because you know someone that's in a facility, or have a friend that knows someone. But if you're not from there, then you have no idea. So you go to those reviews, and they're pretty important and pretty compelling. And I found them very accurate just based on my experience with the facilities in the area. The good ones had good ratings, and the bad ones had bad ones. So I think this bill would be very harmful to the business practices of the people who are providing the most information that's free and available and trustworthy. And I think it would be harmful to the folks that everyone's saying they're trying to protect. Be happy to answer any questions.
Thank you very much. Appreciate it. No.
Thank you, Mr. Chairman.
All right, thank you. Next in opposition. Good morning.
Members of the committee, my name is Bev Allen, president of Liberty Link Missouri. Want to go on record against, well, first off, there's multi-issues, but that's no big deal here anymore. That seems to be the way we do things. But then specifically on page 34, line 13, where it talks about consent for the blood withdrawal, but no consent needed for the mandated treatment. So we can fix that maybe.
Thank you very much. I appreciate it. I'm assuming no questions. Okay, thank you. Next in opposition. All right. For informational purposes only. No. All right, well, this concludes our hearing on House Bill 943. A motion to adjourn. Second, we are adjourned.